Good evening, ladies and gentlemen. This is Louis Fremkes. I am the director of the Center for Writing and Culture at Hunter College. And tonight's guest speaker is Dr. Richard Francis, who I shall now introduce. Richard Francis was the founding president of the American Academy of Addiction Psychiatry, as well as past president and medical director of Silver Hill Hospital. He has been listed as a Castle and Connolly Best Doctor in Psychiatry for the past 20 years. In addition to being the author of many books in psychiatry, he is a frequent guest expert on Court TV. Good evening, Richard.
Hi, Louis. It's nice to be here.
Okay, since our subject, pretty much, while you were not confined to it, is going to be addiction, let me begin by asking you what addiction actually is.
I think so many families in America are affected by having a family member or a member or themselves having a problem with an addiction of some sort or another. Very often it's alcohol or drugs. Now we sometimes include other addictions like gambling, uh, video games, sex, other kinds of addictions that people may have. Uh, but one of the things that we've been especially interested in is also the comorbidity of other psychiatric problems along with addiction. And while I would consider addiction a major branch of psychiatry itself, there also is this whole area of the fact that people with addictions have other mental illnesses, and a significant part of having another mental illness is often having an addiction with anxiety disorders, schizophrenia, bipolar disorder, etc.
Richard, but what I meant by this question for a lay audience is
Yeah.
what does it mean to be addicted? What
It,
is that? How do you identify? How do you recognize it in yourself?
Yeah. Well, if you have a compulsion that's leading to problems in your life, if it leads to work problems, family problems, if you're taking substances and you're increasing the amounts all the time, and you have tolerance, you have withdrawal, and you go into withdrawal when you stop using alcohol or another drug. Uh, these are signs of addiction. But we also we have different levels of substance dependence, mild, moderate, severe. Some people, some people may notice that they're drinking a little bit too much, and they could just cut down a little bit, or half the amount of drinking, and have major good health consequences from doing that. And there are other people with really serious problems who've tried to do that over and over again,
Hmm.
who really need to do no drinking, no drugging, no matter what, and really stop completely.
What is the most common addiction among the general public?
Aside from breathing, Lewis, and
Is that an addiction?
yeah, can't stop joking around with you because we're old friends. But I'd say probably at this point, it's alcohol dependence is the most common addiction. But
Is
we
that because
yeah.
alcohol is legal to have in the home? I mean, can someone be addicted? For example, alcohol, everybody has alcohol in their home, and it can lead to negative outcomes in different ways. What about chocolate? People refer to I'm addicted to chocolate, I'm addicted to this or that. Are those true addictions, or is that just
you know,
some sort of?
anything in extreme excessiveness might be a problem for somebody in their lives, but I wouldn't call those things in the same category. It's funny when you ask what's the most common thing. Probably years ago, it was tobacco dependence, because
Right, right.
most of the people who smoked tobacco became addicted, whereas only about 10% of people who drink will at some point have a major problem in their life with drinking. Now, a very high, maybe 75 or 80% of the population drink, so that's a lot of people with alcohol problems. But we have serious problems in this country with opiate addiction. We're going to have increasing problems with marijuana dependence as marijuana is legalized.
Mm.
We have problems with lots of other substances. I'm really very afraid about the commercialization of things like marijuana, and maybe at some point psychedelics may be commercialized if they become legalized. So there's problems with a lot of different substances. Some drugs have come in and out of fashion in the past. Meprobamate was once a very widespread addiction. Um, uh, um, uh, Barbiturates were once very widespread. Um, Methamphetamine is pretty widespread. Cocaine has had periods up and down where it's a major problem, but there are major problems with many, many different substances. OxyContin
Is fentanyl the drug of the moment?
Fentanyl is the most lethal drug of the moment, and it's 50 to 100 times more potent than morphine. So people who have pushers, and pushers are always trying to get you to take things that are inexpensive, and fentanyl can be inexpensive, it gives a tremendous high. And so, but even a little larger dose than you're expecting to get can kill you. So we're getting massive, massive deaths.
How do you, excuse me, Richard, how do you recognize, if you're let's say you're a teenager, young adult, whatever, fentanyl can be disguised in many ways, packaged in many ways. How do you know when you're getting it? Or do they push it as, this is candy, this will make you feel good? What can a young person do to avoid being sucked into a,
I think when I talk to young people, whether it's my own grandchildren or schools or people ask me these questions all the time.
right,
Um, the best thing is to not take drugs from anyone that you don't know, and even now you're going to be able to buy marijuana very soon in a local store. Well, now they're giving licenses to people in local stores who were marijuana dealers in the past. That's
yeah,
pretty frightening because they're supposed to be good at marketing marijuana, but you never know what's going to be laced in
right.
things. Uh, Once you're dealing with, so I would say for teenagers, they should stay away from drugs at all, including marijuana, which are dangerous to developing minds. But one of the problems is they don't know. You don't know what you're getting when you go to a dealer. And, you know, a lot of my patients love their drug dealers. The drug dealers make them feel good. They make them feel great. And I'm telling them no about a lot of stuff. They don't like to hear that.
I'm
So
not talking
trust the
just about
dealer.
people who go to dealers. I'm saying some of the young people aren't going to a dealer.
No,
It's
they're
just
going
they may disguise it and someone says, try this, it's candy, it's this, it's
well,
that.
dealer may be a good friend of theirs.
Right.
One of the ways for a kid to get to be cool in school or to be, or let's say your parent is a good entrepreneur. One way to echo what your parent does is to become an entrepreneur drug dealer at a young age.
Yeah.
So, the problem is it can be a friend. It can be somebody that you think you trust. It can be an older brother or sister.
So would
And
you advise them to just reject any offer of anything that someone tries to give
yeah,
them?
yeah. That'd be my advice because I think even as a trained professional, I couldn't tell for sure whether a blunt that's being handed to me is something that just contains marijuana and tobacco, or whether it could contain an opioid or other substances that I would know about, and or psychedelics of one sort or another. So I think the problem is for young people to be aware that you don't know what you're getting, and that the next dose that you take could be quite dangerous, and much more dangerous than you think.
Let's switch just for a moment and talk about you. How did you, one, get into psychiatry? And after that, how did you narrow it and to where you became interested in addiction?
It's interesting. I went to NYU Medical School and I trained at Bellevue, where there was a lot of alcohol and drug problems, and some of my teachers were wonderful. But I would also say that some of the role models I had were terrible. And alcoholics and drug addicts were treated not very well often by people. Some of the nurses were actually wonderful. I ended up going into the military, and I was assigned to run an alcohol treatment program. And I met Joe Persh, who was Betty Ford's doctor. and he trained me in running an alcohol treatment center in the Navy. The Navy programs were wonderful. That's where Betty Ford went for treatment. And then when I came out of the Navy, I combined the good alcohol treatment that I saw there with good psychiatric treatment that I had been trained in at Albert Einstein, and started a dual diagnosis addiction psychiatry unit at Cornell in White Plains. And we were beginning to invent addiction psychiatry in those days. That is, understanding the people who had alcohol and drug problems, but also along with their psychiatric illnesses. That was also being done at McLean in Boston, and at Silver Hill Hospital, and at Timberlawn in Texas. There were a couple of other hospitals doing it, not many. And in 1985, I started something called the American Academy of Addiction Psychiatry. We now have about 2,600 members, and it's become a major national organization. So in those days, there really weren't addiction psychiatrists, but now we have thousands of addiction psychiatrists. We started an addiction psychiatry board in psychiatry. So it's become a major field. Unfortunately, I wish I could say that the problem has been more licked over the years from all the things that we've done, all the research, all the programs we've developed, all the education. I've trained hundreds and hundreds of psychiatrists in addictions, and AAAP has trained 46,000 doctors in prescribing buprenorphine and other things. But the problems are bigger now than they ever were. It's not like we've really made a dent. We have treatments, we have some good treatments, but they're not perfect. And we really—
Is there anything, let's say you identify an individual, a listener says, I know I'm addicted to this. What can they do about it? Is there anything they can take to counter the addiction? Or if not, and they're unsure, where do they go to get help?
Yeah, well, those are really important questions, because there is help available for people who have problems. The biggest problem is getting people motivated to do something about a problem,
Right.
because this is an illness that tells you you don't have it. So most of the people who have alcohol and drug problems are in denial about their problem, and it's hard to get them to see it. So first, you got to listen carefully, and you got to look for signs that they want help, and to try to get them motivated to get help. Sometimes coercion works. Drug courts are wonderful. Sometimes families can pressure people, or jobs can pressure people into getting treatment. But often it's really hard to get somebody to seek out help. 12-step programs are wonderful. People can go and seek out 12-step programs. But also we have
What are those? What are those called?
12-step programs.
Oh,
Alcohol
12-step. I'm sorry.
Anonymous is the most famous of them. It was started by Bill Wilson, and Lois Wilson started Al-Anon.
Yeah.
And
You met her once, didn't you?
that's a very interesting story, Louis. I don't know if we have time for it, but I was a young psychiatrist at Cornell, and I get a letter from Lois Wilson, who was 96, saying if Bill was still alive, he'd want to know how to help more alcoholics. Could you come to my house in Bedford and tell us how the Stepping Stones Foundation, which is a sister organization of AA, how to help more alcoholics. So I went to her house, and I said three things. I said, AA is mainly designed for men, and you don't do enough to help women, and we don't study alcoholism in women enough. This was around 1985 or something like that. She was 96 years old. And then I said, I said also, a lot of people with alcohol problems have mental illness, and we need to really be able to find a way to help people who have mental illness along with alcohol problems. Sometimes people in those days told people not to take their medication if they had medication prescribed by a doctor, because they said, don't do anything, don't take anything. And people need medication. And the third thing I said is, AA doesn't open itself up to scientific study. We really need to understand how AA and 12-step programs work. At the end of the day, she said, young man, it was being recorded, but she said, young man, next time you come to my house, could you please speak a little louder? I'm hard of hearing. And I'm going to read the transcript of what you said, because we've been recording it. But, and then, you know, we corresponded later. But at that time, what I got out of it was, we psychiatrists, we sit on our butt and we listen to patients all day. but we need to speak a little louder. We need to get out there, and we need to try to educate the public more, and we need to be able to speak out about problems like that. And I think over the years, we have addressed some of those issues. There's been some wonderful textbooks on alcoholism in women, and we've done many more studies on alcoholism and drug abuse in women. One of the co-editors of my textbook, Kathleen Brady, along with Shelley Greenfield, have a great book on addiction in women for professionals. And then we've also developed the American Academy of Addiction Psychiatry to help with dual diagnosis patients and to deal with mental illness along with addiction.
Do you think educating young people in school, should there be courses in grade school or junior high school where they give them early education about the dangers of drugs?
We need to find better and better ways to prevent alcohol and drug problems in young people, and I don't think we have all the answers yet. And some of the kinds of programs that we do now don't work that well. You have a really beautiful young girl who says she went to Silver Hill Hospital. She goes to speak at a private school and tells everybody about how she got treatment. And the kids all think, geez, she's really cool. First, I have to become an addict, and then I'll go get recovery, and then I'll, so it's tricky. How do you get the message across that that you really need to be careful about alcohol and drugs, and that now, especially nowadays, with marijuana becoming more and more prevalent, about a third of kids in high school are using marijuana. About a third of those will go on to develop marijuana dependence. And how do you, how do you get kids in high school who think it's cool to not use marijuana or to wait on drinking? Some of this is also genetic. Like, there are going to be some gene pools where they're very highly prone to developing addiction. And for some kids, if they wait till they're 21, even if they have both parents with alcohol or drug problems, if they wait till they're 21 before they even try alcohol, they have a much better chance of never developing a problem. But how do you get that message across to a young person who wants to try everything, where their parents have been drinking, where their culture is a very drinking culture, or also they may start with other drugs and then develop problems with other drugs? Because the seeking of pleasure in our society, maybe chocolate's a better idea, Louis. I mean, both of you and I have had trouble with French fries. And I think
I got over mine, Richard.
yeah, right.
Listen,
Well,
let me once again turn the conversation.
yeah,
You there this is a writing center. In addition to having literary speakers, we have scientists like yourself, doctors. But what talk about writers that you've known about or heard. What famous writers have well-known addictions? Why
well,
do writers become addicted, and et cetera, et cetera?
I'm glad you asked me that one, Louis, because I was going to say, 2/3 of the Nobel laureates have had problems with in writing, have had problems with alcohol or drugs.
Is that right?
Hemingway, Faulkner, Berryman, just the list of people. As a matter of fact, I begin to think when I watch movies and I look at the Academy Award nominations, half the movies are related to alcohol or drugs in one way or another.
Mhm.
And it's not surprising because so many writers have had troubles in their childhood. You and I both know many, many people. We talk about them all the time sometimes, who really have suffered in their childhood for one reason or another. And then, as a way of repairing that, write. And they also drink, and they also drug to
Sure.
self-medicate for whatever PTSD or trauma or illness that they had as a child may have ticked off or set off something that got them to use writing as a way of repairing it. And then they write about their own experience, and their own experience is often very interconnected with their alcohol and drugs. And one of the problems is, I think you writers, I'm not going to say you because I know you, but there are so many writers who glorify alcohol and drugs, to the point where you read novels about Hemingway did this and he did that and he's so great, and there's so much fun involved with the drinking and all the parties, and then at some point there's a crash, and then there's depression, and
Yeah.
or people like Churchill. He saved the world, and he would make very funny comments about the joys of drinking and all of that, and he had a lot of fun with it. But he also had serious depressions, and um,
Which comes first, the depression or the alcoholism?
um, very important question. One of the major figures of our time, has something called the self-medication hypothesis, that people are mainly self-medicating with alcohol and drugs, and it's a king drug to try to get rid of whatever anxiety or problem they have.
Mhm.
I wrote a rebuttal in the Harvard Review of Psychiatry, saying, Ted Kansian, who wrote about this, saying that it's the wrath of grapes is worse than the grapes of wrath, was what I wrote, which is
Interesting.
that very often it's really the drinking that's ruining people's lives, and is more of a problem. It's getting people off of alcohol or off the other drugs, but there's probably some of both. Some people are self-medicating emotional problems, and very often about half of people with bipolar disorder have alcohol or drug problems.
Is that right?
There's some conditions. There's something called familial tremor. This is a kind of clinical pearl, that people who are born with a tendency to have tremulous hands. You may have met some people like that. Um, can find that if they drink alcohol, it steadies their hands. And this is people who are not going into withdrawal from alcohol, but just have a neurological disorder of familial tremor. About
Sure. And
half,
they use the alcohol as a
and half of those develop alcoholism
mhm.
as a result of trying to treat the familial tremor. Now, I know some people with familial tremor who do not develop alcohol problems, but many will discover that it'll treat that condition.
What allows some people to drink and not become addicts, and other people, the minute they start drinking, they can't stop? What is it in the personality? How do you know whether you're when you begin to drink, or that you're more likely to become an addict,
Yeah.
or you
Well,
can drink safely?
yeah, you know, a lot of this is genetics, and those people who have biological first degree relatives with alcohol or drug problems are much more likely to develop a
I
problem
see.
than
That's
somebody else.
interesting.
So if you've got a grandfather or aunts or biologicals, just beware, and you need to be careful. But if the first time you drink, you get sick, and you throw up, and you just don't feel good on it, you're less likely to develop a
Right.
problem with alcohol. If the first time you drink, you can drink a lot and have a great time, and you've got a wooden leg, you have a high tolerance, you're more likely to develop a problem with it.
How do you feel about the psilocybin situation in Oregon?
Yeah, well, it's not just Oregon, but what's happened has been, there have been some studies finding that psilocybin might be a treatment for depression, maybe even for addiction. And the studies are not that good, and they're really early, but they may be enough for the FDA soon to prove it. And what's happening in Oregon is they've made it legal for people who take a course to start prescribing psilocybin. But again, these things start getting commercialized, and you get hucksters who take a course, start giving out psilocybin to people. And I've seen people on psychedelics. I mean, I'm reading about psychedelics being useful in psychiatry. It's worth researching it. But I would take the papers with a grain of salt rather than a cube of sugar at this point, because I think the evidence isn't that strong yet, and I've seen patients jump out of windows and
Sure.
make serious suicide attempts and have much more severe mental illness. So a lot of the studies that are being done, where they're good studies by reputable people like Steve Ross at NYU, are being done in very controlled studies settings, where you have two therapists and they're talking the person through things in a very, very controlled way. And even then you worry about, I mean, some of these researchers are legitimate people that I trust, but you worry that when this gets out to the wider world, there are plenty of hucksters out there. And we saw what damage happened with Purdue, with Purdue Pharma really pushing OxyContin, and hundreds of thousands of people dying from overdoses related to opioids. We got to be very careful about the commercialization of substances that can give you pleasure but are very abusable, and may the whole way that this thing is developing. I mean, in some countries, if you're going to legalize marijuana, the government produces it and distributes it. There's no advertising, and there's no, here it's almost like we're trying to get ready to figure out how much tax money can we get out of marijuana.
This was going to be my next question. How do you feel about legalization of marijuana or any drugs that are not viewed necessarily as serious drugs, but there's a movement to legalize them?
Well, the movement's very strong, and it's going to happen. It's happening. The problem is the effects on young people, which, until kids are 24, the developing brain is susceptible to marijuana. But I'm not sure I want um, all the bus drivers and train drivers and everybody who's driving cars stoned all day long,
No,
or
obvious.
if I go to a brain surgeon, that he's going to be. I'm kind of joking about it a little bit, but to have a society where this is going to be very, very widespread, and where a significant number of people who will use it will become physically dependent on it, because marijuana is a dependence producing in many ways physically as tobacco, in the sense that once you use it regularly, if you use it every day, if you stop using it, you have trouble sleeping, you have more anxiety. You're not to speak of people of large bulk like us who may have increased appetites, and it may not be good in that regard. And so the medical benefits of marijuana have been overrated. There may be some, and certainly for cancer patients and patients with certain kinds of epilepsy, there may be some uses, and there may be some pain uses, but it's being hyped up. I think the issue is, how do you decriminalize marijuana without commercializing it? How do you not have so many people in jail, related to marijuana, without making it such that that everybody in college is going to be switching from alcohol to marijuana, thinking that it's totally safe when it isn't. I think we're going to have societal problems, and not just from that, but from the creeping legalization of more and more substances that are abusable. I think we should have learned something about and the fact that once the pharmaceutical companies get involved, or once companies get involved, they're just really good at pushing snake oil of any kind, and we got to worry about that.
Are there any benign addictions?
Are there any benign? Well, we talked about breathing, which is one that I love. Beating of hearts is, um, the whole thing about. I really don't know that we should get into it, but is it good for people to be in love and to have a good sexual life? Sure. Is it a problem if people have a compulsive, self-destructive need to go to hookers and risk their lives in various ways? But everything has to do with how
degree and
agree, and so the Greeks, knowing about living in moderation, makes a lot of sense. And
have you yourself ever felt that you were becoming addicted to anything?
Well, I know that I've been addicted to French fries and to food, and so in the last couple of years, I've dramatically begun to see myself as a food addict, and took steps to try to change that. I've lost about 60 pounds.
Do you think that would be an important way to go for the huge obese population here, everywhere? There are many, many people who obviously are trying to lose weight and not successful with it. How should you think it would be a wise course to treat it as an addiction? What,
Well, I think it is. I think food can be an addiction, I would also say
but it's hard to identify it
I'd
as
say
an addiction.
bulimia can be whether we look at these as compulsions, they're certainly very related, and even binging and purging can be dependence producing, where people
Right,
get to it and then it becomes a way of controlling their weight, but it's dangerous in terms of health, etc.
sure.
The answers about how to get better weight control, uh, in general, it's a very complex problem. Nobody's really solved it,
No,
and that's my point about the beginning of this, Lewis, when I said that addiction psychiatry has progressed a lot in certain ways. We have thousands more studies, and we have many, many more better trained people, and we're much more enlightened. We have not really dented the issues at so many levels. I mean, we're going to be seeing more and more video game addiction, um, pornography addiction, all kinds of issues that become,
yeah,
affect our young people and affect people at any age. And we need more study, and we need more knowledge about how to do it. So I would say I feel very proud of starting the American Academy of Addiction Psychiatry and a board exam in
yeah,
addictions, all of that. But I feel when I've had patients who've killed themselves. I've seen I've seen patients in jail who were addicted to alcohol and drugs and going through withdrawal and have mental illness and suffer
hmm,
enormously. And
sure,
the severely mentally ill in this country are being treated abominably generally out there. So I would say that we have such a long way to go as a society in tackling what is one of the most complicated and difficult problems. And what's interesting is, as you say, all the writers write about it. We see it in the movies all the time. Yet we're in more denial about addiction than anything else, and it's
yeah,
almost like a secret in so
right.
many ways. And
Rich, hold on one second.
yeah,
Sophia, can you hear me?
Yes.
Are you there? Are there any questions that have come in from the audience?
Yes, we have some
Why
questions.
don't we take a few questions from the audience? Richard, go ahead, Sophia. If you could read one to Richard.
Of course, we have Pamela asking, so why are alcoholics chastis suffering from a disease, but New York says smoke weed to the point you're so high and no law against it?
yeah.
Is that clear, or can you
Well,
read?
I think what's being asked about is the whole stigma of of alcohol, or even compared to other substances. I don't know that I'd want to compare stigmas of this substance versus another, although all of them, anybody with a problem with alcohol or drugs can be stigmatized, and often. Your question about how does somebody get better? Sometimes it just takes somebody caring a little bit about somebody who's got an illness with addiction, and showing enough concern to try to get them to seek help and to get
Sure,
treatment for it. And often it's the stigma that keeps people away from talking about their problems, especially women. Very often are drinking or using drugs secretly and not telling anybody, and uh, uh, just because it seems like such a terrible thing to admit that you have a problem in our society where it may not be accepted that well.
right.
So,
Sophia, if there's another question, ask it to Richard. And Richard, her voice is low. Could you repeat whatever the question is so that we can hear it?
okay.
Okay. We have another question. I'm writing from San Francisco. How do you feel about safe sanctioned areas for using drugs, Melinda Pressler.
Yeah, yeah. Gee, that's a complicated problem
What
because
is the question?
the question is, what about state-sanctioned places for people using drugs?
Oh,
In New York City, there are several approved places where you can inject opioids and under a supervised way where you're not going to have an overdose and where you're not going to get fentanyl. And so far, these and issues like needle exchange, how much do we do harm reduction as a way of treating addictions? Certainly things like Suboxone as a substitute for opioids and methadone, these things are very, very useful and very, very helpful. But the idea of, do you let somebody inject heroin in a controlled manner in a place where you're going to be able to watch for overdoses? And there are people who are advocating that that may be one of the ways that we're going to be able to deal with severe addiction, and then try to convince some of those people to get onto buprenorphine and to switch over to Suboxone or methadone and to get treatment that way. Suddenly, I lost the screen. I'm not sure why. Oh, I know why. Somebody's trying to call me, and that makes me lose the screen. So now I have to launch the meeting again. Can you
Sophia, any more questions?
Can you see me? 'Cause I
Yes,
lost the.
yes, we can see you.
Is there another question?
Yeah.
We have, how do we explain the 30 to 40 million new patients on Adderall?
Oh, yeah. That's another major issue.
Repeat the question for the audience.
The 30 or 40 million people who are on Adderall, how do we explain that?
Yeah.
And first of all, there is a valid condition called ADHD, where kids who, especially, when it starts early, I mean, now they've raised the age to 12 to have been able to diagnose ADHD. It used to be 7. And a lot of pediatricians and child psychiatrists are prescribing, and behavioral neurologists are prescribing ADHD for kids that have problems with attentional deficit and hyperactivity. And many of these kids need it. Now, there are other kids, and I'd have parents bring teenagers to my office saying, can't you diagnose them with ADHD and put them on Adderall, or get them to be able to take longer to take their tests, et cetera? And when I question them, the kids are heavily using alcohol, marijuana, other drugs. And the reason they're having attentional problems isn't that they have real ADHD, but they're already developing problems with alcohol and drugs, and ADHD, and adding Adderall is not going to help. There are people, there are a lot of experts who feel there's an overprescription of Adderall that's occurring in this country. And I think that, I think the real answer to that is, when it is appropriate, it actually helps. Like Biederman and Willens up at Harvard have found that kids who have real ADHD and who get treated for the ADHD have less alcohol and drug problems than kids that don't. So it's really a problem of getting an accurate diagnosis and making sure that you're treating the right thing and that you're not overprescribing. And sometimes parents will abuse their kids' ADHD meds. Some kids hand out their ADHD meds to other kids to study for tests. There's a lot of abuse of Adderall on college campuses for people trying to do better in school on ADHD, thinking that it's going to improve performance, et cetera.
Thank you, Richard. Sophia, let's take one more question.
Okay. Can you have an addiction without daily usage?
Yes. Well, you can. What you can have is you can have.
Repeat the question, Richard.
Can you have an addiction without daily usage? And I think that what we're referring to there could be that you could have a binge problem with almost any substance, but there are people who will have times where they'll binge drink and get themselves into terrific difficulty on binges, and where they can't stop at 1, 2, 3, or 4, but keep going until they get into major difficulty with alcohol. And that can happen with other drugs too. But I guess when you're talking about physical dependence, that's going to happen more often when you're using on a regular basis.
I think probably we could go on for hours, but I want to thank you for what I think is a terribly informative, entertaining, and wonderful talk, Richard Francis. Thank you for being our guest tonight. A great thinker, and indeed you are. I'd like to say goodnight and thank the audience for joining us.
You're a better friend than I am a great thinker, but we'll leave it at that.
Okay, Sophia, I think we're going to call it a night.
Okay.